Dr. Chatterley, we have talked about how periodontal disease is really devastating to a person's health, no doubt about it. Now, however, just like with almost all dental work, it looks like that as patients are stuck in the past. And, when I was a kid, the needle for an injection, it was like a pencil. I mean, it was huge, you know what I'm saying? And you're laughing. You probably...
harpoon, huh?
Yeah, exactly. I mean, it frankly was probably more painful, and it's really not painful anymore, but we're still stuck in that. I hear it with parents telling their kids on how, what they need to look forward to when they get ortho work, which is just not true anymore. You're not wearing those, gears anymore. What about periodontal disease? What in terms of treatment, what has happened there? Are people fearing it for nothing? Is there good treatment out there? Can it be all fixed? Is it painful? Does it have long after consequences? Are you out of commission for a while? What's the deal?
There are definitely innovations and methods that have been developed that can treat gum disease, periodontal disease. There's non-surgical. Probably the thing that out in the public that scares people to have their gum disease, they may know that they have some and that their parents had it and their parents lost teeth and had dentures. But probably the thing that scares people away from treatment is the horror stories of patients that have gone through the traditional periodontal surgery. And there's an alternative to that now. It's a laser approach. But before somebody's condition gets to the point that they need surgery, there's non-surgical approaches of what's called scalar and loop planing. So there's a big array of improved treatments that are less invasive and has been found out about the disease is caught earlier, treated more quickly. The media and the toothpaste and the mouthwashes have done a lot of advertising and as a consequence have done a lot of education. People are more aware of gum disease, so they're becoming more compliant to seek assistance and seek it earlier when it's not as advanced and it can be treated non-surgically. So, yeah, nobody needs to be afraid of resolving gum disease because it's much more resolvable.
And even if a person needs a surgery, you say with the new laser surgery, it's like compared to the old days, it's like 1, 2, 3, and it's done and it's over with, and it's not painful and all that stuff, or at least not as painful.
Right. Well, the old way is, the word amputate might come in. They reflect the gums, they alter the bone, and then amputate the excess gingival tissue and suture it back, and the roots are exposed, and the roots are very sensitive thereafter. That's the old surgery. A newer method that's been developed is laser periodontal therapy with a specific laser called Nd:YAG laser. And people think of laser, they probably think of Star Wars and the light sticks, but a laser, there's various lasers, and tissues respond to the various lasers because the various lasers have different frequencies, therefore different capabilities, and different tissues respond in different ways. The Nd:YAG laser, it was discovered about 20 years ago, got a very favorable response in the process of periodontal treatment. And so various practitioners worked with it and refined the technique, did the research, did a lot of treatments, reported in the literature, and it's been developed as a very viable option to resolve the more advanced gum disease. It's far less invasive, and what's really exciting about it in comparison is that under the right conditions, that the attachment of the gums to the tooth and the bone can regenerate to a point. It's not always predictable, but it's time and again occurs, and under the right conditions, we can get bone and attachment regeneration, and in the process, it's less invasive, less painful, actually a little quicker, and works out very well for the patients.
Good news, good news. So basically, with no doubt from everything I heard so far from you in other areas, technology improvements and innovations have not bypassed dentistry.
Oh, absolutely not.
All right.
It's almost hard to keep up with everything that's happening.
That's great. Thanks a lot again, Dr. Chatterley, for your
You're
candidness.
welcome.